I have the pleasure of introducing the next speaker, who's Mr. Stuart Carr. Stuart has been a faithful servant to the clinical HIV enterprise for more than the past 2 decades. He has had multiple roles over that time. He began as a receptionist in the clinic. He's also functioned as a research administrator, regulatory coordinator, all of which has prepared him for his newest role as a coordinator in the clinical core. And he has grown to become the CFAR most valuable player. Congratulations, Stuart. He also serves as an important link to the CAB. And so today he's going to update us with regard to the CAB. Welcome, Stuart.
I don't want to get too close to this. Can you hear me? Thank you, John. That was very, very nice. Very, very nice and touching. Yes, I do involve myself with the Community Advisory Board. It's the Duke AIDS Research Treatment Community Advisory Board, or DART, CAB. I found out the other day that the CAB was founded in 1990, so it's been around 25 years. Initially founded due to the fact that we had started doing treatment research in HIV. One of the things that I do is represent the CFAR at the CAB meetings. So I'm going to read some of this and talk some of this. The DART CAB serves as a voice for the community in relationship to research and other related activities being conducted in the adult ID clinic, the pediatric ID clinic, through the Ryan White Care Grant, which we have, and those related to CFAR-funded or assisted research. The DART CAB is really very welcoming, and they really want to help. So one of the things that they do is we have people come and present ideas that they're going to maybe do studies with, or they are working on studies, or they might be in the middle of them or the end of them, and at times they give advice and recommendations as to what might help that person's research, what, if their research has a population even sometimes, because it's, you know, a little bit of a disconnect sometimes between what we think we can do and what we actually have. But they're very helpful, and they were very welcoming, and they really want people to come and participate. So you don't have to be HIV infected, or as we say, HIV affected. You can be someone who is just interested in the community and in research and just in the way things are going with HIV in general. One of the things that the CAB has really kind of changed into in the last couple of years is they've become very focused on education. And it's not just HIV education, but predominantly HIV education. We've had a number of really wonderful speakers in the last year, some who have been here this morning, like Dr. Susanna Nagy, who talked to us about hepatitis C infection and treatment advances, Dr. Christina Mead, who talked about recruitment on substance abuse studies, and even we had a talk on Ebola by Dr. Christopher Woods, because the community was interested in that topic at the time. We've also had Allison Rice from the Duke Law and Chrissy Diedrichson from the UN AIDS on criminalization of HIV and the history of efforts at global decriminalization. We had Dr. Lance Okeke, who spoke on HIV and cardiovascular diseases, and Dr. Barbara Johnson, who is from the Durham Department of Health, who discussed Durham Knows, which is an HIV testing initiative that they're doing there. We hold an annual forum every year, and this year it will probably be, if I'm not mistaken, December 7th. I'm not quite sure who's going to be there, who's going to be speaking, what we're going to be doing, but that will come. We have had speakers in the past, though, that have been really quite dynamic. Some of these names you may know, some of these names you may not know. Heidi Broadbent, Jim Halley, Ray Lewis Thornton, Reagan Hoffman, and Magic Johnson have all spoken at these forums. The next CAB meeting will be on Monday, October 19th in room 124 in Trent Hall. Generally, we have these meetings on the third Monday of every other month from 6 to 7:30, and we do provide a nice little dinner at 5:45. So anyone who's interested in wanting to speak at one of these meetings, you can contact me, you can contact Trish Bartlett, you can contact Julietta Geiner, and we'll get you on the schedule. And I think that's about all I have right now. Does anyone have any questions? I'll ask that question.
Questions for Stuart? Okay, thank you, Stuart.
Thank you, John.